When I first became a health coach, I was honored anytime I was invited to speak. But there was one panel in particular that showed me just how unwelcoming the health and wellness space can be, especially for Black women like me. And as painful as that experience was, it ended up being one of the most important lessons of my career. Hi, I'm Tanisha Campbell, and I equip healthcare providers with actionable strategies to challenge bias, reduce healthcare disparities, and deliver equitable, patient-centered care that truly serves Black women. In 2017, I was invited to speak on a panel in Boston. I was excited, grateful even to bring a Black woman's perspective into a space that rarely included our voice. At first, everything felt fine, but in the middle of answering one of the questions, I noticed another panelist rolling her eyes at me, and this wasn't subtle. Everyone saw it. And the energy in the room shifted immediately. And while I did my best to recover, that moment really stuck with me. And as much as I hated how it made me feel, it ended up being one of the best things that could have happened early in my career because it taught me an important lesson: know your audience. I had accepted that opportunity with good intentions. I wanted to share my lived experience. I wanted to offer a different perspective, but I never asked the important question: who am I really speaking to? And that's something I see happening all the time in health education. We speak to people as if they're all the same, as if they have the same access, the same background, the same understanding of health. And when they don't respond the way we expect, we call them non-compliant. But here's the truth. It's not that clients don't care about their health. It's that many of the plans and messages we create don't reflect their lived reality. We forget about the cultural context. We ignore food preferences or spiritual beliefs. And we assume health literacy levels that many people just don't have. Then we blame the individual instead of questioning the system or ourselves. And as someone who values health education deeply, I believe we can do better. But we need to move beyond cookie cutter content. We need to stop shaming people for circumstances beyond their control. And we need to recognize that education without empathy isn't education, it's judgment. Here's what I know for sure. Black women deserve the same quality of care as everyone else. Health content should never shame people, and we can create trauma-informed, inclusive content that balances clarity and care. It doesn't have to be perfect. I've made my fair share of mistakes, but I've also committed to learning from them and to doing better moving forward. After 9 years of writing, teaching, and creating health education content, I've learned this. The words we choose matter. The stories we tell matter. And the people we center matter most of all. So if you're ready to write health content that educates without harm, I invite you to join me. Make sure you're a member of the EBWH community to stay updated on this important series. You'll find the link in the description below. We don't need more perfection. We need more people willing to care deeply and communicate honestly. Let's do this work together.